Chapter 8, Heart and Blood Vessels, Screencast 3. The topic of this screencast is going to be blood pressure. Now, blood pressure is the driving force that's responsible for moving blood through the vessels. Now, remember, the cardiovascular system is a closed system. Fluid in a closed system is exerting force or pressure on the wall of those vessels. And that's what blood pressure is. It's generated by the heart itself. Now, when you've gone to the doctor's office and had your blood pressure measured, you'll always say one number over another. Now, systolic pressure, that's the top number, and that is the highest pressure as blood is being ejected during ventricular systole. Now, the other thing to remember here, when we're talking about blood pressure, it's arterial. Diastolic blood pressure, that is the lowest pressure as blood is returning back to the heart during ventricular diastole, or what is arterial pressure as the ventricles are relaxing. So once again, systolic pressure, you want to think of it, what is pressure in the arteries as the ventricles contract. Diastolic, what is pressure as the ventricles are relaxed. So that's an important thing to keep in mind. Now, we measure pressure in a clinical setting indirectly using a blood pressure cuff, or the fancy word, sphygmomanometer. So that is the device used to actually measure blood pressure. Now, the top number, once again, is called systolic, and that's arterial pressure as the ventricles are contracting. And the bottom number is diastolic pressure, and that is pressure in the arteries as the ventricles are relaxed. Now, we're going to talk next about what are considered normal readings, hypertension, and so on. Now, a normal reading is when systolic pressure is less than 120 millimeters of mercury, and a normal diastolic pressure is when it's less than 80 millimeters of mercury. Keep those numbers in the back of your mind because we're going to come back to them. Now here, this is showing the drop in pressure across the entire vascular system, so all the vessels. So it's highest on the arteries, starts to begin to drop in the arterioles, lower in the capillaries, low in the venules, low in the veins, and by the time it gets back to the atria, it's pretty much zero. And the difference, between pressure at the beginning and here, that's my driving force. So that's my net driving force overall. Typically, it's about 85 millimeters of mercury. Now, this is the technique that's used. And what's happening here is with the combination of the blood pressure cuff or sphygmomanometer and the stethoscope, the clinician is actually listening for certain sounds. Those sounds are called Karakoff sounds. Now, systolic blood pressure is recorded as you're releasing the pressure in the cuff and you first hear a tapping sound. So that's going to be recorded as systolic pressure. And diastolic pressure is noted as when you no longer can hear the sound. Okay? And that's why you need a stethoscope. Okay? And so that's that general process that's being used to have an indirect measure of blood pressure. Now, a direct measure of pressure would actually require the placement of a pressure transducer in the artery itself to measure blood pressure, and that's just not practical. Now, originally, 120 over 80 was called high normal. Okay, now they have changed things. Okay. Now, high blood pressure is actually a very serious condition. The problem here is we refer to it quite often as a silent killer, and there are no symptoms associated with people that have high blood pressure. Now, I'm going to give you an example. You have probably heard me use the phrase, I did not pick my parents well. Well, this is one of those situations where I have been on high blood pressure medication for probably 25 years. So, 20. Sorry about that. Okay. Well, I've been on blood pressure meds for a long time. And I am quite the overachiever when it comes to high blood pressure. When I was first diagnosed with high blood pressure, my systolic pressure was 190 and my diastolic pressure was 110. That's really high. And even when it was that high, there were no symptoms. Now, currently, I am on medication, excuse me, it's known as a ACE inhibitor, and that does a really, really good job at regulating or helping to control my blood pressure. We'll talk about other things that we can do. But this is a perfect example. You can't take a look at someone and tell that they have high blood pressure. I might be a little overweight, but I eat fairly well. I try to exercise somewhat regularly. And especially since I have this risk factor, I have to do those things that I can control. Now, as you can see here, high blood pressure is defined as a systolic pressure greater than or equal to 140 millimeters of mercury. Diastolic pressure is when it's greater than or equal to 90 millimeters of mercury. Now, one of the reasons why we're so concerned with high blood pressure or hypertension is the risk factor it is for cardiovascular disease. It actually creates more resistance, so the heart has to work harder. Okay? The blood vessels will react by becoming hardened and scarred and actually the development of plaque or that process of atherosclerosis. And once again, there's an awful lot of strain being put on the heart itself because now it has to generate a much higher pressure to open up the aortic semilunar valve. And as noted before, there are no symptoms associated with high blood pressure. And when I was first diagnosed, and once again, my pressure was 190 over 110, no symptoms whatsoever associated with that. Now here, this is something that I would like you to be familiar with, and there may be questions on the exam related to that. Now notice, okay, so 120 to 139 or 80 to 89, that used to be known as high normal. That is now noted as pre-hypertension. Now, stage 1 hypertension is when systolic is 140 to 159 or the diastolic 90 to 99. Now, keep in mind, you do not need to have both systolic and diastolic out of range to be considered hypertensive. Only one of these values, so either systolic or diastolic. Now, stage 2 hypertension, and this is what I would have been diagnosed with, is when the systolic blood pressure is 160 or greater, or diastolic 100 or greater. So as I said, I'm an overachiever. I had extremely high elevated systolic and diastolic blood pressures, but please keep in mind that my medication does a very good job at controlling and regulating my hypertension. Now here, one of the things that I want you to be comfortable with, what are the risk factors for hypertension? And you are going to notice, as far as the following: heredity, age, race, and sex, we consider those to be non-modifiable. Okay, so quite often you're just stuck with these. They quite often are due to heredity, our age. Okay, so family history, that's a major contributor. As we get older, there's going to be an increase in blood pressure. That's due to that process of atherosclerosis creating greater resistance in the arteries. When we look at race, African Americans have twice the incidence found in Caucasians and Asian Americans. So they are at greater risk for hypertension. If we look at males versus females, males are more likely than females. Now, the rest are going to be modifiable. So these are things that you can control with your behavior. And those are going to be obesity, sodium intake, smoking, sedentary lifestyle, persistent emotional stress, diabetes mellitus, oral contraceptives and certain medications, and the heavy consumption of alcohol. So once again, obesity, sodium intake, smoking, sedentary lifestyle, persistent emotional stress, diabetes mellitus, heavy alcohol consumption, and the use of oral contraceptives and other medications, those are modifiable risks. So we can do something about those. So that's an important thing to keep in mind. And you'll notice these are also considered to be risk factors for cardiovascular disease. Quite often, I ask my students to think about 4 general behaviors that we have control over that greatly impact our risk for lifestyle-related diseases. Excuse me. And what those 4 behaviors are: 1, nutrition. Okay, how good is our diet? 2, smoking behavior. Okay. 3, do we drink or not? Okay. And then 4, exercise. So all of those are things that we are in control over. Now, just recently, there was a paper that actually indicated that sedentary lifestyle is as significant or greater a risk for cardiovascular disease as smoking. Let's think about that. Okay. Having a sedentary lifestyle is at the same degree of risk or maybe greater than that of smoking. So that's a big deal, and that just came out recently. Now, the opposite of high blood pressure is hypotension or low blood pressure. Now, what we want to keep in mind here is the lower the better, as long as there are no symptoms. Now, symptoms could include dizziness or fainting. A really good example is some of you, if you stand up really quickly, you may feel that lightheadedness. Okay, that typically is known as a postural hypotension. Now, other things that will result in a low pressure would be anything resulting in excessive fluid loss, so bleeding, fluid loss from burns. Any of those, okay, can result in a lower than normal blood pressure. But one thing to keep in mind, this illustrates how important it is to be hydrated. So if you're dehydrated, that is another thing that may actually cause blood pressure to drop. Because once again, think of this. You have less fluid in a closed system exerting less pressure against those walls of those vessels.